ticks, for most of us, they're just that gross little thing you find on your dog or cat after a walk.
Yeah, an annoyance. Maybe makes you shudder a bit. But it turns out there's a whole lot more going on with them.
Right. We've been digging into some really detailed expert sources, all focused on tick control and the diseases they carry in our pets.
And it becomes pretty clear pretty quickly these aren't simple pests causing simple problems. Far from it.
Exactly. So our mission today in this deep dive is to unpack all that info, get to the heart of it.
Figure out what's surprising, what's essential, and what you really need to know about the risks these complex little arthropods pose.
Perfect. Let's jump in. Okay, first things first. What are ticks, fundamentally? Because the sources are quite clear they're not insects.
That's a really key starting point. No, they're arthropods, part of the arachnida class. So think spiders, mites, scorpions. They're more related to them.
Oh, okay. Spiders. Makes sense.
And these hard ticks we're mainly talking about, they have this one purpose when they find a host, feeding, and only on blood.
Just blood. So is the main danger just them drinking blood, like anemia?
Well, that can definitely be a problem, especially with heavy infestations. But the primary threat, the big one, is their role as vectors, disease carriers.
Right.
While they're feeding, they can transmit this whole range of pathogens. Tiny things like protozoa, bacteria, viruses, even things called rickettsia.
Okay, so diseases. But is that it?
No, there's direct harm, too. The sources mention things like toxicosis, systemic reactions, and hypersensitivity, like allergic responses.
Oh.
And then there's tick paralysis, which is really serious, caused by neurotoxins in their saliva, and, like you mentioned, blood loss anemia if there are enough of them.
Wow, okay. So that little bite is potentially the gateway to a whole mess of problems.
Yeah.
You mentioned feeding. What's their life cycle like? How do they grow up?
Heart ticks generally have 4 stages: egg, then larva, then nymph, and finally the adult tick.
Larva, nymph, adult. Okay.
The larva hatches, finds a host, often a small mammal feeds, drops off, and then molts, kind of sheds its skin to become a nymph.
And the nymph does the same thing.
Exactly.
Yep.
Feeds, drops off, molts again into an adult. And it's the adult females that have that massive feeding. They can increase their weight, get this, by over 100 times.
100 times? That's wild.
It is. After that huge meal, they drop off, lay thousands of eggs, and then, well, their job is done. They die.
Thousands of eggs. Okay, that explains how tick populations can explode. How do they survive between those meals when they're just out in the environment?
They're surprisingly tough. The sources mentioned they can survive freezing temperatures by overwintering. They can go for long periods without feeding,
Oh.
basically starvation tolerance, and handle lower humidity pretty well, too.
Hardy little things. So how do they actually get onto our pets? I always picture them just sitting on a blade of grass waiting.
And that's a common strategy, yeah. It's called questing. They climb up vegetation, hold out their front legs, and wait for something to brush past.
Right.
Massive ambush.
Right, the waiting game.
But here's something fascinating from the source material. That's not the only way. There's one particular tick that's different.
Oh yeah, which one is that?
The Lone Star tick, Amblyomma americanum. It's actually described as an active hunter.
Active hunter.
A tick, yeah. It can sense a host, the carbon dioxide they breathe out, vibrations, body heat from distance, and actually move towards it.
Whoa.
Apparently up to 60 feet.
60 feet. That's the length of a bowling lane. A tick can hunt you down from that far.
Kind of changes the picture, doesn't it? Less passive waiting, more seeking.
It really does. That's genuinely surprising. Any other weird biology facts like that?
Well, there's this really interesting symbiotic thing they found in the deer tick, Ixodes scapularis. If it happens to be infected with a certain bacterium, Anaplasma phagocytophilum,
Okay.
the tick starts expressing a gene for an antifreeze glycoprotein. Basically, the infection causes the tick to make its own antifreeze.
The infection helps the tick survive the cold.
Seems like it. Better survival in cold weather thanks to the pathogen it's carrying. A very strange partnership.
Okay, so ticks are way more complex and, frankly, a bit more unnerving than I thought. Let's shift focus now to our pets. What actually happens in their bodies when a tick bites, beyond just the itch?
Yeah, the impact goes deep. As the sources detail, heavy infestations, like we mentioned, can cause serious blood loss anemia, especially dangerous for smaller or younger animals.
Right, the blood loss.
Then there's the bite itself. The tick's mouth parts literally cut into the skin. That alone can cause irritation or lead to secondary bacterial infections right at the bite site if it's not kept clean.
Makes sense.
But the really insidious part is the saliva. Ticks inject saliva while feeding, and it's packed with pharmacologically active stuff.
Active stuff, like what?
Well, things that help the tick feed more easily, compounds that stop the blood from clotting so it keeps flowing.
Ah, anticoagulants.
Exactly. And neurotoxins, those are the ones that can cause tick paralysis. Plus, and this is critical, substances that suppress the host's immune response right there at the feeding spot.
They suppress the immune system. Why?
It creates like a little localized safe zone for the tick, produces inflammation and helps the tick, and any pathogens it might be carrying evade the host's defenses. It's basically injecting an anesthetic, an anticoagulant, and an immunosuppressant all at once.
That's remarkably sophisticated. And the sources list several body systems affected by all this skin, obviously, but also hemilymphatic immune, musculoskeletal, even the nervous system.
Precisely. It shows how the effects can spread far beyond just the skin puncture. These pathogens they transmit get into the bloodstream and can wreak havoc systemically.
And how do the ticks pick up these pathogens in the first place?
Usually by feeding on an infected reservoir host. Often these are wild animals like mice, voles, other small mammals that carry the pathogen but might not get seriously sick themselves.
Okay, so the tick bites an infected mouse, picks up the bacteria, say.
Right, and then that infection can persist in the tick population in a couple of ways the sources mention. One is transovarial transmission. The infected female tick passes the pathogen directly into her eggs, so the larvae hatch already infected.
Wow, born infected.
The other is transstadial transmission. That means the infection stays with the tick as it molts from larva to nymph and then from nymph to adult. So an infected larva becomes an infected nymph, which can then infect the next animal it bites.
Got it. So the infection cycle keeps going within the ticks themselves, ready to jump to a dog or cat. Now, traditionally, we thought of certain tick diseases being confined to specific regions, right, like Lyme disease in the Northeast. But the sources are pointing to a shift.
Absolutely. This is a major theme in the material. Tick ranges and the diseases they carry are expanding. The geographical boundaries are blurring.
Expanding. So places that didn't have certain ticks or diseases before might have them now.
Exactly. We're seeing the emergence of tick-borne infections in new areas. And another worrying trend is an increase in co-infections.
Co-infections, meaning?
Meaning a pet gets infected with multiple pathogens simultaneously, either from one tick carrying several different bugs or from being bitten by multiple ticks, each carrying something different. Makes diagnosis and treatment more complex.
That does sound complicated. Can you give some examples of these expanding ranges the sources mentioned?
Sure. So you have your established players like the deer tick, Ixodes scapularis in the east and Midwest, Ixodes pacificus out west, and the American dog tick, Dermacender variabilis. Pretty widespread.
Okay.
But the sources highlight significant expansion for the lone star tick, Amblyomma americanum. It's moving further north and west from its traditional southeast range. And the Gulf Coast tick, Amblyomma maculatum, is also pushing northwards from the Gulf states.
So ticks are on the move. Is there one that's kind of everywhere already?
Yes, the brown dog tick, Rhipicephalus sanguineus, is found all across the continental U.S. And this one has a really concerning trait.
Oh, what's that?
Unlike most other hard ticks that need outdoor environments, the brown dog tick can complete its entire life cycle. Egg, larva, nymph, adult indoors, even in the relatively low humidity of a typical house.
Indoors, so they can infest your home.
Precisely. Homes, kennels, anywhere dogs live. Which makes controlling them a whole different ballgame because you're not just dealing with ticks picked up outside.
Yeah, that's a nightmare scenario. Okay, let's talk symptoms. If you don't actually see the tick, what signs might make you or your vet suspect a tick-borne illness?
The signs can be really varied depending on the specific disease. The sources list things like petechiation, those little pinpoint bruises or red spots, often on the gums or belly. That can be seen with things like rickettsia rickettsii, which causes Rocky Mountain spotted fever, or Anaplasma plagueis.
Okay, tiny bruises. What else?
Limb and joint problems, lameness, stiffness, swollen joints are classic for Lyme disease, which is caused by Borrelia burgdorferi.
Right, Lyme is well known for that.
And the source mentions some rarer but very severe complications of Lyme in dogs, like heart block and a specific, often fatal kidney disease called protein-losing nephropathy. It stresses this kidney issue is linked directly to the Borrelia infection itself, not the Lyme vaccine.
That's an important distinction. Kidney failure from Lyme.
Yeah.
Scary. Any other signs?
Well, there's the tick paralysis we mentioned from neurotoxins in the saliva. And some infections, like Rocky Mountain spotted fever, or rickettsii, can cause neurological signs too, affecting the central nervous system.
So a really wide range of potential problems. Are there any odder ways pets get infected?
Yes. The source brings up a really unusual one. Hepatozone infections.
Hepato what now?
Hepatozone, With these, the transmission isn't through the tick bite. The dog gets infected by eating the tick.
Eating it, like accidentally swallowing it while grooming.
Exactly. Or maybe picking one up off the floor. In this case, the dog is the intermediate host, and the tick is the definitive host. For Hepatozone americanum, it's usually the Gulf Coast tick that gets eaten, and it causes nasty muscle inflammation, pain, fever. For Hepatozone canis, it's often the Lone Star tick or brown dog tick, causing things like weight loss and lethargy.
They have to ingest the tick. That's bizarre.
It's definitely a different mechanism than we usually think about for tick diseases.
So let's bring this back home for the listener. Why does this information, the expanding ranges, the co-infections, even the weird ingestion route, why does it matter to you and your pet?
Because the risk isn't static. Where you live, where you travel, even just changes in local wildlife patterns due to suburban spread, it all affects your pet's potential exposure. Your vet needs this kind of information to assess risk accurately. The old assumptions about what ticks are where might not hold true anymore. Your pet's risk profile is likely changing over time.
Okay, so if there's suspicion of a tick-borne disease, how do vets actually figure it out? What tests do they use?
Well, the sources talk about the convenience of in-office rapid tests. Many clinics use something like the SNAP 4Dx test. It's a quick blood test.
Right, I've heard of that one. What does it check for?
It screens for antibodies to several common tick-borne pathogens like Lyme, Ehrlichiosis, Anaplasma, and it also tests for heartworm disease at the same time. Very efficient.
And are there others?
Yes. Another one mentioned is the Abaxis VetScan Borrelia test, which is specifically for Lyme disease antibodies. And the source makes a really crucial point about these tests.
What's that?
They're designed to detect antibodies the pet produces because of an actual infection from being bitten by an infected tick. They do not cross-react with the antibodies produced after a vaccination, like the Lyme vaccine.
Oh, that's huge. So a positive test means actual exposure, not just that they got their shot.
Exactly. It helps differentiate between natural exposure and vaccine history, which is incredibly useful for diagnosis. And it notes the Abaxis Lyme test is pretty inexpensive, too.
Good to know. Okay, let's shift to something almost every pet owner faces eventually. Removing an attached tick. There's so many old wives' tales. Burning it with a match, smothering it with Vaseline. Do those work?
Absolutely not. The source material is really firm on this, using things like hot matches, petroleum jelly, nail polish, alcohol, and alcohol. None of them reliably make the tick detach.
They don't. I thought they were supposed to make it back out.
Nope. What they can do is irritate the tick, possibly causing it to regurgitate its stomach contents back into the bite wound, or inject more saliva.
Oh, so you might actually increase the risk of disease transmission.
Precisely. It prolongs the attachment time and potentially makes things worse. Total myth and a harmful one.
Okay, so ditch the matches and jelly. What is the right way then?
It's simple, really. Use fine-pointed tweezers, not the blunt eyebrow kind.
Right.
Grasp the tick as close to the skin surface as possible, right where its mouth parts enter.
Right down at the skin level.
Yeah. Then pull upward with steady, even pressure. Don't twist or jerk, just pull firmly and gently straight out.
Okay, steady upward pull. What if the head breaks off?
Usually it's not a major issue if the mouth parts remain. The body will typically expel them over time. The main thing is getting the body off to stop any further feeding or saliva injection.
And after removal?
Just clean the bite area well with soap and water or a little antiseptic. That's usually all that's needed.
All right, prevention. Since completely avoiding areas with ticks is tough for most dogs and even some cats, what's the goal of tick control products? Is it realistic to expect 0 ticks ever?
The sources suggest that while 0 ticks is ideal, often the practical goal is what's called clinical repellence, or, maybe more importantly, rapid killing.
Rapid killing, meaning?
Killing the tick quickly after it gets on the pet, before it has enough time to transmit diseases. Remember, the transmission time varies. Some viruses might transfer fast, but many bacteria take hours, even a day or two, of feeding.
Okay, so speed matters. Does that mean even if my pet is treated, I might still find a tick on them? Maybe one that's alive but crawling, or even attached briefly?
Yes, that's definitely possible, and doesn't necessarily mean the product failed. Many products require the tick to actually get on the host, maybe even start to bite, to be exposed to the medication.
Ah, I see.
So you might see a tick that's wandering around, maybe looking a bit drunk or dying, or one that attached for a short time before the product killed it. Also, those tiny larvae and nymphs can be really hard to spot.
Right. And you mentioned hepatozone earlier, the one they get by eating the tick. Standard skin treatments wouldn't stop that, would they?
Exactly, that's a challenge. If the dog ingests an infected tick from the environment, a topical product or collar won't prevent that specific infection route.
Okay. So what kinds of products are used for this rapid killing or repellence approach?
In the U.S., we're talking about EPA-licensed insecticides and acaricides tick killers. The sources stress that year-round protection is becoming the standard recommendation in many, many areas now.
Year-round, okay.
And the absolute golden rule, repeated strongly in the sources, products specifically labeled for dogs only, especially those with permethrin, must never be used on cats. They can be extremely toxic, even fatal to cats.
Critical safety point.
Got it.
What are some examples of effective products mentioned?
They list things like acaricidal collars, Preventic, Seresto, Scalibor, or examples given which often use ingredients like amitrez, deltamethrin, or flumethrin, known for fast action.
Collars, right. What else?
And then the spot-on treatments applying to the skin monthly, like Frontline, Canine Advantix, Vector 3D, and others. These are really popular for their safety generally and ease of use.
And do we know these actually work to stop disease, not just kill ticks eventually?
Yes, the sources cite specific studies that looked at interrupting disease transmission. These studies show that killing ticks quickly or repelling them really does work.
Any specific results mentioned?
Yeah, they give examples for Lyme disease transmission in dogs. One study showed fipronil, the ingredient in Frontline, was about 75 to almost 88% effective at preventing transmission 4 weeks after application. Permethrin, found in products like Canine Advantix, was 100% effective at 4 weeks in that study. And amitrez, used in Preventic collars, was 100% effective just 7 days after putting the collar on.
Wow, 100% is impressive.
It really underscores that quick killer repellency is key. The faster the product works, the less time the tick has to feed and transmit those dangerous pathogens.
So faster action dramatically cuts the risk of those serious outcomes, like the tick-borne diseases or that awful tick paralysis.
Okay, we have definitely covered a lot of territory in this deep dive, from realizing ticks aren't just simple bugs.
Right, they're complex arachnids related to spiders with some pretty surprising adaptations and behaviors, like that active hunting Lone Star tick.
And they pose that double threat, the direct harm from their bites and saliva, like paralysis or anemia, and then the huge issue of transmitting a whole host of serious diseases.
And a really key takeaway is that the landscape is changing. Tick ranges are expanding, new diseases are popping up in unexpected places, and co-infections are becoming more common.
We also learned that vets have good diagnostic tools, like those rapid tests, that cleverly avoid confusing infection with vaccination history.
And that getting ticks off requires simple, steady pulling with tweezers. Forget the folklore about matches or Vaseline, which can actually make things worse. Right. And finally, prevention isn't always about zero ticks, but about using products that kill them fast or repel them effectively to block that disease transmission pathway. Though some challenges, like that weird hepatosome ingestion route, still complicate things.
It really paints a picture of tick management as an ongoing, evolving process for pet owners, vets, and even researchers.
Definitely. So to wrap up, here's something for you to think about. We've heard today about these clear trends, expanding tick territories, new infections emerging, multiple infections hitting at once. Given all that, how might our fundamental approach to protecting our pets, the strategies we rely on year after year, need to change, need to adapt in the coming years to really keep pace with this evolving threat?